On this episode, we're going to talk about marketing Invisalign, what patients are looking for in a website, and is dentistry becoming a commodity? Hey everybody, what's up and welcome to another episode of the 88 Dental Marketing Show, the internet's only show answering dentistry's most important marketing questions. I am your host, Joshua Scott, and this is episode number 12. Feeling good on episode number 12, coming off of knee surgery last week. If you watched last week's episode, you know I mentioned it. And by the way, thanks the texts and the emails. I appreciate for sure checking in on me. Going good. Up moving around a bit here for the first time. Not really bending my knee much, but it's just kind of stretched out here underneath the desk. These guys were my good friends for the weekend. Hydrocodone, acetaminophen. So I had a good weekend with those guys, but I'm off of it now. I'm actually not on any pain meds at this point, just a few Advil this morning. So we're making some progress. I was thinking actually it would have been fun, right, to pop a few of these and shoot an episode. Just kind of loosen things up a little bit. But yeah, so I don't need those guys, and I was just feeling it, man. Like, hey, we need a show. There are important questions out there, your questions that got to be answered. So somebody's got to do it. Let's shoot a show. So we're here. Another reason things are going good. I'm in a good mood. Ordered the Apple Watch a few days ago. So I'm stoked about that. I'm excited about it. Laying in bed with credit card information and a computer, being bored, it's probably not a good thing. So, but you know, I don't know. I was sitting there thinking, the last few weeks I've been thinking about it, and I thought this was worth talking about. It's not a question of the show necessarily, but what I found myself doing with the Apple Watch, which I thought was really interesting, was I was making a case why it wasn't going to succeed. And I found myself saying stuff like, you know, I'm just not in the market for more notifications. And I got really focused on that, on the notification part. Like, why would I want to put something on my wrist with all these notifications when, goodness, I can barely manage my phone and computer and the mass amount of notifications there. And so, you know, I was saying stuff like, you know, I don't think this is going to take. I don't think Apple is going the right direction. And all this stuff. And in the end, what I realized, what I really believe with this is whether or not the watch succeeds or fails, that's not the point. Like, we're missing the point. The point is, this is a game changer. And wearable smart tech is the future. And Apple, in the way they do, being the pioneer into a new space, it's a space that's going to only grow in the future. And so they've launched into it, you know, and it's like, leave it up to them. Leave it up to Apple to take something and give it to us. And we didn't think we needed it or didn't know we needed it. But in the end, we go, wow, this is really amazing and life-changing. And so, yeah, so I got in. I bought in on it. Yeah, I've been an early adopter on the first iPod, the first iPhone, the first iPad. So the Apple Watch is no different. So hopefully in the next few weeks, you'll see a little debut. Maybe we can get a little action of that. Until then, let's get to some questions.
Our first question is from Dr. Heather Ray. How do you market Invisalign?
Dr. Ray, good question. The answer here is going to be similar to a question I answered a few episodes back on marketing orthodontics. You know, I think anytime you get into these specialty services, the marketing approach can be very similar. I mean, landing pages, AdWords, all that works great. A few things I'll say about Invisalign. Number one, the thing we have to realize is Invisalign went from like a startup 10 years ago in 2001, 15 years now. So it went public in 2001 to the largest orthodontic company in the world today. And so I say that because Align Technologies, the parent company of Invisalign, has invested billions of dollars into marketing Invisalign. So much so that patients know it by name. I mean, that's what they may be asking about clear retainers, but they're saying Invisalign. They're marketing or they're searching for Invisalign. And so any marketing you do along these lines with Invisalign, those dollars only stretch further. It just does more because of what Align Technologies has already done. So jump on that, Kimosabi, because those marketing dollars stretch further, okay? Secondly, just a small tweak. When it comes to Invisalign, I always use the word invisible with it. So I would say something like invisible braces with Invisalign or invisible braces by Invisalign. Because what Invisalign did, what they realized was there was a whole market of people out there that didn't want braces, but they wanted straight teeth. And so that's what Invisalign did, was created that whole market space. And so that's what people want, is they want invisible braces. Now, is Invisalign invisible braces? No, it's not braces, it's a retainer. It's not invisible, it's clear. But that's the benefit. That's the benefit patients want, is they want an alternative to walking around with braces on, something that's invisible, something that's removable, something that's convenient. And so those are the words I would always use with this. I think that that's important, that we're speaking to the benefit of the patient and not the technology, so to speak. And so, do those things. I think landing pages with a lot of information, especially including teen Invisalign, would be huge. Google AdWords are a great play because people are searching for that. If you're a preferred provider with Invisalign, make sure you're making that known. All those things are hugely important. Write articles about it, post it on Facebook. We've got a few offices right now. We're running some spring Invisalign promotions and on Facebook. And so we've created a series of ads focused at teenagers with an offer, like $200 off Invisalign treatment. And then we took those same ads and tweaked them to be shown to adults during that same period. And the thinking was, a teenager sees the ad on Facebook and says, "Mom, we've been talking about Invisalign. Here's a practice that's doing it for $200 off." And the mom has maybe already seen that ad on her Facebook feed earlier that week or the week before. And so it helps make that connection and drive that sale. And so lots of fun stuff you can do with it. Hopefully those will help.
Question number 2 from Janelle Neal. What is the first thing potential patients look at on a website?
Yeah, Janelle, easy. I'll give you 3 things, okay? Number 1, we live in 2015, and so good design is a huge factor. Anymore with the progress we've made in the web space, websites just look beautiful. And so you gotta have a site that's designed well. If you don't, I don't think patients can see past that, especially in an industry like dentistry. It's highly aesthetic, highly cosmetic, right? So I mean, a patient that sees a poorly designed web space and then sits down in a chair with a doctor who's prescribing aesthetic cosmetic treatment, I just have to think that there's a huge disconnect there. And so I think we've got to do that. It's not okay any longer to just say, well, this is a dental industry style type site. Like, it just doesn't work. We need to up the bar, okay? So number 1 is good design. Number 2 is a picture of the doctor. High on the list of what patients want from a website is they want to see what the doctor looks like. They want to know if you're a normal looking person. And so I think it should be on the front page. I think it should be easy to find. And so get a photographer to come in. I'm not a big fan of these like head and shoulder shots, with the lab coat and the profile and it's clinical looking. I mean, bring in a photographer and do a session with your family or do a session with your staff. Like, just show people that you're smiling and you're normal and you're having fun and enjoying life. That will go so much further. And then last, number 3, is they want to see a picture of the facility. They want to know what they're walking into. Patients just, I say all this to go, they just don't want to be surprised, right? So they want to know, are they walking into a residential home, or is this a medical condo park, or is this a freestanding building? Like what is it? Give them an idea, like just visually help them map out that environment before they get there so that they're not surprised. I think if you do those three things, I mean, that's like the 80-20 rule. That's the 80% of a website. The other 20%, talk about it, figure out what you need. In the end, it may not make a difference. I think you close the sale probably on those three things more than anything.
And our third question from Charles Brennan: is dentistry a commodity?
Nice. Good question. Good question for sure. Wow. How do I go? So, this is one of those questions that you put up on a forum like Dental Town, and you get hundreds of comments and replies to it, and hundreds of opinions as well. So I think, look, a few things. I think commoditization is not something that's unique to dentistry. Number one, I think a lot of industries have faced this. There's a lot of industries that are currently facing this. It's kind of a natural progression of society and technology and where we're moving. And so I think sometimes we can make this like it's unique about us. And, we talk about insurance and cost and patients price shopping and Obamacare and all those things. But in the end, I think that this is something every industry has had to navigate. And so, look at restaurants, for example, right? So here's a good question, okay? Are restaurants a commodity? Okay? And so, look, at one end of the spectrum, we've got restaurants like McDonald's and Wendy's and Burger King and Tim Hortons. And I think we can make a strong argument that those are commodities. It's cheap, quick food. There's a race to the bottom with pricing. We see that with dollar menus. That's their market. I mean, if you are running late for your son's baseball game, cheap, quick food is the solution a lot of times. And so there's a market for it, but I think we can argue that strongly that that's a commodity. However, on the other side of that, we have a restaurateur here in Columbus named Cameron Mitchell. And he just opened a new restaurant in my area. And I feel like anytime he opens a new restaurant, it's like you can't get into it for 2 to 3 months. It's just packed. I mean, everybody wants to go there and see what his latest concept is. And so, these are restaurants that, man, they're priced at the high end of restaurants in this city, probably some of the highest priced in the entire city. But yet, if I am looking for a place to go to on a Friday night with my wife alone with no kids, I want one of those restaurants. I mean, I want the long, intimate dinner with personalized attention and specialized service. I mean, that's what I'm looking for. And at that price point, like, I'm okay with that. And so I think in the end, it's like, well, so restaurants, on one side, yeah, you could probably argue they're a commodity, but on the other side, they certainly aren't. I think what creates that differentiation is the experience. Is this, what kind of experience do you want? Do you expect? Are you getting? And so, is one right or wrong? No, not at all. I mean, there's a market for the McDonald's of the world, and clearly there's a market for the Cameron Mitchells. The thing you have to know is your model and what you're trying to do, because McDonald's would go out of business trying to create the experience that Cameron Mitchell has, and Cameron Mitchell would go out of business trying to compete with McDonald's prices. And so as a dental business owner, I think you have to know like where you are on that spectrum and know what your model is. Is one right or one wrong? No. In fact, I sometimes this whole argument of commodities, I don't know if it is a right or wrong answer. I think it's okay if you're at that end, but you need to know that your model needs to make money, and you have to figure out who your patient base is, who that market is, and how you're going to be profitable. At the same time, if you're on this side, same rules. Know your model, know what your patient base is, and how you're going to make money. The thing I do know is that there is a market for both sides. There's a market for people that just want cheap, quick dental care. And man, there's a market for people that want the longer appointment with specialized service and personal treatment. Clearly, both of those exist. And so I don't think it's a question so much of whether or not dentistry is becoming a commodity. I think it's more of a question of what is your model. So guys, I hope that helps. I hope this episode has created some value for you. This was episode number 12. I enjoyed it. Thanks so much for being here and being a part of this. Your homework for the week. Look at your website. Remember those 3 things? Good design, picture of the doctor, picture of the facility or the practice. Do you have those? And then rate yourself. Are you doing a good job with them? If not, maybe we schedule a photo shoot. Maybe we get a little bit of a redesign. Start talking through that process. But do a quick analysis of your website. Do you have those 3 things? Guys, thanks for being a part. I will see you next episode.